I also grew up in a chronic pain family. My dad had 3 spinal fusions. I know exactly what you're going through. I know what your family's going through. And in this episode, we're going to cover 2 home-based therapies that can reduce your pain and get you moving, maybe even get you out of pain. So you don't want to miss this episode.
Welcome to the Defeating Pain Podcast with Dr. Ted Arkfeld. If you're tired of treatments that just don't work, you're in the right place. Each week, we'll talk about new ways to beat chronic pain using at-home therapies. You don't have to go to the doctor to feel better. Let's help you start living pain-free. Now, here's Dr. Arkfeld.
You know, the truth is, pain that you're experiencing right now, it may have started off as a structural or a mechanical problem. Maybe you herniated a disc. Maybe you needed a surgery. Maybe you fractured something. Maybe you did something to a joint. It started off structural, but it's not structural anymore. You've gone through the PT, you've gone through all the spinal injections, you've been to chiropractic, but you're still in pain. That's because they've been looking at it from that structural standpoint. It's now a neurological issue. It's your nervous system. And it's not just what we call the peripheral nervous system where you touch your hand, you can feel all that or the movements. It's actually gotten into what we call the autonomic nervous system, your emotional center. Let's face it, if you are in chronic pain, it's emotional. You're frustrated. You may even be anxious. You haven't been sleeping well. You may be heading to depression. You may be in depression. So it's all encompassing, and nobody's talking about this, are they? Nobody's telling you, listen, we have a comprehensive care plan for you to get you out of pain, get you moving, get you sleeping, and get you out of that fight or flight mode. Has anybody said that to you? I doubt it. Otherwise, you probably wouldn't even be watching me right now. I have tested this out since 2016. In 2016, I made a major commitment to helping patients in chronic pain. I had treated a lot of post-surgical low back conditions with some success, but when I made this commitment, and the commitment was to bring in BioWave, to bring in brain tap, and to bring in ARP neurological therapy, and to bring in Normatec. When I brought those things into the clinic, we started to make a difference, a big difference in patients' lives. One of my patients, Melissa, 2 surgeries, thought she was doomed. She was having terrible pain, was just barely able to function through the day while teaching. She is a teacher, a mother too, and we got her life back. Barbara, same thing. All Barbara wanted to do after she had surgery. Oh, by the way, and they told her, we don't know what to do with you anymore. After 8 weeks of PT, after her surgery for her low back, they just said, we don't know why you're still in pain. Well, that's because they weren't looking at the neurological aspect, and most chiropractors and PTs don't. No pain management specialist I've ever come across is going to look at it from the lens of your nervous system. That's what we do. And you know what's exciting right now? You don't have to come into my office. We created the Defeating Pain podcast because in 2016, I brought these therapies in and we started seeing amazing outcomes. And then COVID hit. We came up with a home-based therapy protocol. And I've been fine-tuning it since COVID. And now it's ready for you. This home-based protocol, you can do the BioWave Go multiple times during the day. You can do the brain tap multiple times per day, all from the comfort of your own home. So I want to give you hope, and I want you to know that you can start that home therapy today. What is BioWave Go? BioWave Go is not a TENS unit. It is a special type of stimulator that what it does, it goes down to where the pain is being produced. We call that nociceptors, and it blocks it. It forms a force field so the pain can't get out and into your spinal column. See, once it gets into the spinal column, then it's like a super highway right on up to the brain where you'll perceive the pain. Well, it doesn't allow that to happen. That way, we can calm the muscles down. You can actually do some exercises with BioWave Go on it. You start moving. That is key. And then we use Brain Tap. Brain Tap resets your brain's pain processing ability. It unleashes your own pharmacy, pain pharmacy, right in your brain that's just sitting there. But here's what it really does. It helps you get to sleep. You've got to get sleep at night. That's where the healing is going to occur. And when you can do that, it's going to reduce anxiety. It's going to reduce depression. It's going to reduce mental fatigue, brain fog. It's going to help you start being the best version of you like you should be right now. So here's the best part of this whole episode. We're offering a no charge movement screening. Technology has now evolved to the point where all you have to do is have somebody take their phone and take a picture of you, your posture, while you're just standing there, and then do some squats, both front, side, and back. And they're going to record that in a video. And then that will get sent to me, and I can analyze it and tell you exactly where the abnormal movement is and what muscles are being affected. It's called Posture Screen and Posture Screen Mobile. Now, the way that you're going to do that is you've got to send me an email, DRARKFELD, Dr. Arkfeld at arkfeldchiropractic.com. You got to send me an email and in the subject line, say, I want posture screen. And then what I'll do is I'll send you a link for you to take care of all this. And then we can get started. I'm going to recommend, because you've had too many people telling you things, I'm going to recommend that you get BioWave Go and you get Brain Tap. Now, BioWave Go, there is a 30-day money-back guarantee, but we've not had anybody do that. Everybody loves it. And when you combine it with the Brain Tap, that's our 1-2 punch right there. The links will be below, so you can go on and order. If this excites you, if this gives you hope, if this resonates with you, then please like this episode and, make a comment and share it with your friends. And let's get the word out. Subscribe to the podcast because you're not alone anymore. I'm going to walk this journey with you. That's why I became a doctor of chiropractic. After all these years, I can help people where nobody could help my father. I can now help you. Just let me do it. In the next episode, we're going to break down how posture and movement are the keys to solving the pain problem. We've got to move. We're not going to mask the pain, not with spinal injections, not with medications. We're going to get you moving. Don't worry if it hurts to move right now. We're going to help you get moving in a pain-free manner. So you don't want to miss that episode.